I'm going to just tell you a couple things about vitamin D supplementations. Okay, so the first trial I looked at was there were 24 trials of over 5,000 participants who took vitamin D supplement at about 2,000 units per day, and they saw a 30% reduction in small for gestational age size babies. You can take a vitamin D supplement and reduce your risk of your baby being abnormally small for gestational age. And 2,000 units a day is sort of a standard dose, so I don't think there's anything unusual about that. And then the other study to tell you about was about 1,200 women who took vitamin D preconception. And they looked at the vitamin D levels in these women, and they saw the outcomes and compared them for people who had adequate levels of vitamin D versus inadequate levels of vitamin D. And what they found was in the group of women who had appropriate levels of vitamin D, they had decreased risks of miscarriage, increased probability of actually getting pregnant and having a live birth. So, here's another example of sort of a normal dose of vitamin D improving outcomes in pregnancy. So I do think that evidence is mounting for people to take vitamin D supplementation preconception as well as while you're pregnant. And it does appear that it's going to help improve outcomes. So I do think that's a good idea. I'd say I recommend it.
Hi, my name is Dr. Jen Anneker. Thanks for joining us on our video today. Today our video is about vitamin D. So it fits into 3 pillars of what we're always trying to give you information about wellness tips, and this is obviously going to fall under a wellness tip today, answer chiropractic questions, as well as give you a little insight into some of the things that I do for my own healthcare. So my name is Dr. Jen Anneker, and I'm the owner of Anneker Clinics of Chiropractic. A huge part of our practice is preconception and pregnancy. And so while vitamin D that we're going to talk about today, there's definitely a lot of conversation that can happen about vitamin D or around vitamin D for other populations. These are the 2 that we're choosing today to just give you some of the benefits. It's going to be a little bit more listing, but it's going to help you to understand the whys of vitamin D. So first off, vitamin D, we should go back into, it's a vitamin that we get from the sun. And if you live in more of a northern climate, it's going to be harder to get, especially a lot of times they say in the months of September, October through March-ish. And sometimes it gets even harder to get that vitamin. But especially if you're in a northern climate, whether you're in this population that we're going to talk about or not, it's a huge thing to think about as far as supplementation. So vitamin D, first off, before we dive into the benefits, the vitamin D that we carry is actually a brand called Innate Choice, and it's a fantastic product. Ours is liquid in organic olive oil. And so the vitamin D, the question is always, well, how much should I be taking? So the Vitamin D Council says for every 25 pounds of weight that you should take 1,000 IUs or international units. That's the unit that vitamin D is in. So now we're going to dive into kind of this list of the benefits for, first off, preconception. Preconception is huge for implantation of the egg onto the uterine wall. And so obviously this would help to prevent miscarriage. So that statement alone, we could stop this video and that would be a huge piece of information. So that vitamin D level is huge to have in adequate zones or adequate amounts. So obviously the miscarriage, the other things that might carry into, what we want for preconception Pre-conception is obviously the hormones working sufficiently, and so for hormone regulation, it also helps for a role in the ovaries, the uterus, the placenta functions of it. It increases testosterone, sperm quality, libido, and also if you have adequate levels for preconception, your odds of getting pregnant are 4 times greater. So those are some great facts about the whys to make sure that your vitamin D level is adequate for preconception. Now we're going to change topics. Next, kind of as we preconception, now we're going to go into pregnancy. And so this is all about, again, health. We still have the hormone function, which is huge, but we want to make sure that your body's functioning properly. And part of the challenges that a mom might have that vitamin D could help out with, or to make sure that they have, again, those adequate levels, are preeclampsia or high blood pressure. So it helps with that, gestational diabetes. And again, because of the implantation and the health of the baby, that it means that it decreases preterm labor. And I was blown away by this stat as I was researching for this video, that if there's inadequate levels of vitamin D, it increases C-section by 400%. That's a crazy stat. So again, just better function overall. Also increases the immune system, so it means less vaginal infections, and just helps out for the mom to have a better immune system during her pregnancy. And then for the baby development, it helps with cellular division and bone health. And so vitamin D, again, it's really a no-brainer. So I challenge you to think about getting a good source of vitamin D, whether you're in these 2 categories of preconception or pregnancy. It's going to help your body just be healthier as a whole. But even if you're not in these populations, think about that. For every 25 pounds is 1,000 IUs, and just make sure that your body's on board, because there's a lot of organ and gland issues that rely on vitamin D to have adequate function. So I hope you found this helpful. Obviously, this is specific for our pregnancy population. We certainly would enjoy any feedback for those that are pregnant or have young families that have additional questions they want me to answer. Please put it in the comments below. Again, we always appreciate your time, and have a great day.
So let's talk a little bit about prenatal vitamins. It's important for a woman to start taking the prenatal vitamins before she gets pregnant. I usually recommend about a month before they go off any kind of birth control, so there's an overlap. The most important component of the prenatal vitamin is the folic acid. It helps prevent neural tube defects. What you want to look for on the back is make sure it has at least 800 micrograms of folic acid, and then that's a good prenatal vitamin. The prenatal vitamins that you buy over the store that label themselves prenatal vitamins have a lot of extra stuff that's probably unnecessary. The most important part's the folic acid. Once you're pregnant, it's important to add something called DHA, or omega-3 fatty acids. And a lot of prenatal vitamins have it, but a lot of them don't, so you have to read the label and make sure it has it, or just buy it separately and start taking it as soon as you're pregnant. And then that one you should stay on while you're breastfeeding too. The folic acid really is better before you're pregnant and in the first trimester.